Good evening and welcome to the 2017 Friends of Mercy. We are very happy that you could join us this evening. So what is a friend? If you look it up in the dictionary, you will find a few different definitions. The two that best fit the Mercy Health Foundation are one attached to another by affection or esteem, one that favors or promotes something such as charity. I would like to add to those definitions by saying that a friend of mercy is one who believes in the mission as set forth by the Sisters of Mercy.
Thank you to the supporters of the Mercy Health Foundation for purchasing this GlideScope that allows us in the emergency department to intubate difficult airways in children and adults. Donations to the Mercy Health Foundation have also allowed us to have rocking chairs for our littlest patients and enhance the play area in our visitors lounge in the emergency care center.
This is one of our new STEP that we're using in our cardiac rehab program. It helps our cardiac and our pulmonary patients increase their usage of their arms, increase their tolerance while we're monitoring their heart and their oxygen to make sure everything's going well.
Well, thanks to the generous donations from the Mercy Foundation, Mercy Tiffin's OB department has benefited, and the patients have benefited from donation of these little car beds. And what we use car beds for, an infant who would be too small to ride in a regular infant car seat. Another product that the foundation has provided for us is a cuddle cot. This is for families who experience an infant loss, and this enables the family to spend more time bonding with the baby after the baby's delivery.
We would like to thank the Mercy Health Foundation for purchasing our sensory swing frame for our new pediatric kids facility.
Our pediatric swing is not only used for positive reinforcements after completion of therapy tasks, it's also used to increase balance and strength of our children, and it also helps them with sensory processing issues. They become more aware of their space and their body in their space, and it also helps them calm and prepare themselves before they complete an age-appropriate task.
Thanks to donations to the Mercy Health Foundation, the ER was able to purchase a state-of-the-art piece of equipment called a Zoll AutoPulse. This piece of equipment is 4 times more effective than manual chest compressions for a patient needing CPR. It also allows for decreased staff fatigue, which allows those staff members to better care for the patient in other areas, and also allows the staff to take care of the patient's family during this time.
In cardiac rehab right now, we're seeing about 100 to 120 patients per week coming through. All of our patients are on the treadmill for about 20 minutes. So as you can gather, we've used them a lot. 3 of our treadmills are over 10 years old, so we desperately needed some new treadmills, and our business has actually increased quite a bit, and we needed to add another treadmill to be able to better serve our patients. So the new treadmills are definitely a wonderful addition to our department. Thank you.
Mercy Health Tiffin Hospital has been serving our community since 1913, first at the original hospital on West Market Street, and now at 45 St. Lawrence Drive. In order to continue to fulfill the mission of the Sisters of Mercy and serve our community with high quality and convenient health care, we have a number of needs that would enhance the care that our professionals deliver on a daily basis. Having access to surgery in Tiffin for area residents is crucial in providing high quality care close to home. Having robotic surgery in Tiffin would enhance our professionals' ability for shorter surgery time, allow patients to return home the same day, offer shorter post-op recovery time, thus allowing patients to return to work sooner, decrease the possibility of post-op complications, and provide less pain after surgery, thus allowing mobilization sooner. At Mercy Tiffin, procedures have increased by 15%. 90% of the procedures performed are outpatient surgeries, thus a need is present to create a third operating room. Benefits would be shorter wait times and more efficiency and convenience for patients. Cardiology disease is the #1 cause of death in the United States. Mercy Health Tiffin Hospital has grown its cardiology services to provide convenient access to high-quality services without the need to leave the community. Leaders in Care, Dr. Stephen Brule and Dr. Ali Ahmad, serve over 350 patients each month. The goal is to reach all patients in Tiffin and nearby communities who are interested in staying near their home and receive state-of-the-art care. In order to do so, we need to renovate the cardiology suite. A new and improved cardiology suite will save and change lives. Relocation of our OB/GYN physician offices will bring state-of-the-art space to this Mercy practice, thus providing convenience for area women in need of obstetrical and gynecological care in a comfortable setting. This relocation will allow for continued growth on the Mercy campus, as well as help further develop relationships with providers and collaborations with other groups. With the goal of keeping as many surgical patients in Tiffin as possible, we would like to enhance our surgeons' ability through the provision of state-of-the-art equipment. This would include a new operating table that would provide the latest in technology. New laser instrumentation will enhance our urologist's abilities and allow for improved timeliness in caring for his surgical patients in his increasingly busy practice. The purpose of the laser equipment is to enter the bladder and ureters and fracture the kidney stone. This allows the physician to retrieve small segments without damaging the surrounding tissue. Mercy values all life and is especially conscious of those most vulnerable. Regular Code Atom drills are held so that staff members are always aware of possible situations in an uncertain world. The HUGS infant security system delivers an unprecedented level of security against infant abduction. HUGS offers the reliability that one can depend on every day to keep infants safe. The Xenex Light Strike Robot, state-of-the-art germ zapping machine, is the only light disinfection technology known in multiple studies to reduce infection rates in 5 minutes. This technology eliminates 100% of surgical site infections for total joint replacements and results in 46% fewer infections in surgery. Unrestricted contributions are extremely important to meet needs that may not be apparent at the present time. These dollars allow our foundation board to be able to access funds when needs arise.
Our parents always kind of instilled in us that you should try to do business locally whenever you possibly can. And so we'll always support local hospitals like we will car dealers and suppliers and subcontractors.
In the course of time, we have had children, we have had accidents, we've had boo-boos, and we've had just wellness. Mercy has always been there, and we feel that we need to give back. So that's basically why we both think the same way, that we need to support Mercy and the foundation.
I think having an outstanding hospital is very important to our community. It is important that we continually support our local hospital and that we help with these funds to secure our hospital stay a top-notch hospital that we have had for our community.
Thank you for attending this evening's Friends of Mercy celebration, and thank you for being a friend.